Hi there. Welcome to another session, Rumination with Andrew. It's indeed my pleasure to be with you one more time. Now, today I just got a um, feed from my YouTube channel on the Hill, right? The Hill, that's the Hill newspaper and media outlet in the United States. And they were reporting the fact that the feds in the United States, that is, had paid the media houses money to promote vaccines. And I thought that was interesting because, I don't think that was a secret, right? I think that has always been an open secret that the government, was pushing the vaccines and used any outlet that it could to ensure that its agenda was carried out. So I just wanted to share with you briefly what the Hill was reporting. So listen to this YouTube piece. Let me get my things up on the screen and connect it. Let me get it here on the Hill. Right, so I'm on the Hill and I'm going to have you listen. I might have to take out my, so there goes it.
This news story may be of interest to quite a few of you. The federal government has apparently paid media outlets to promote the COVID-19 vaccine, according to new reporting from co-author of The Illusion of Consensus Substack, Rav Aurora.
Rav writes that independent journalists alerted him to a FOIA request filed by the media company The Blaze, which found a number of major media outlets such as the Washington Post, the LA Times, NBC, CNN, Fox News, and others paid to promote the COVID-19 vaccine. Also, the U.S. Department of Health and Human Services COVID-19 public education campaign states that they employed, quote, both paid advertising and media interviews, presentations, radio, TV tours, and other public events to educate people about the importance of vaccination. Joining us now to discuss is co-author of The Illusion of Consensus Substack, Rav Aurora. Thank you for joining us, Rav.
Hey guys, great to be here.
So help us understand the scope of the vaccine, COVID vaccine promoting going on in the mainstream media. Obviously, we know that mainstream media figures were very encouraging of the COVID vaccine, but is it just advertisement? Because I mean, frankly, people, including the government and also private interests, advertise with the Hill, our parent companies, and it doesn't influence what we say about anything. It's just, the revenue model for how things work. Did this go beyond that?
As far as we can tell, no. There's no evidence to suggest that it has gone further than that. But I think this raises some serious questions about how journalism functions. And just to back up for a second, so this was a FOIA report, FOIA request filed by The Blaze, and this was published last year. And it was remarkable to see that it didn't get much media coverage, and maybe understandably so, because the report included the fact that many media outlets like the Washington Post, LA Times, New York Post, Fox News, CNN, they all had received funding from the federal government to promote the COVID vaccine. I think it's not necessarily as explicit, or people want to go down conspiracy theories and maybe think about, well, if they're paid, does that mean that they're directly told what to say? I don't think it's anything of that sort, but I do find it a little strange and disturbing that many of these advertisements, right? If you go on the HHS website and they have this COVID-19 vaccine promotion campaign, several of their advertisements, just a quick cursory glance of these 10-second, 30-second ads, reveal that many of them contain just complete falsehoods, like advertisements about if you have kids that are 5 years old, getting COVID is unsafe, whereas the vaccine is clearly safe. There's no evidence to suggest that is a plain, indisputable fact, especially given concerns around myocarditis and the extremely low infection fatality rate in kids. And the newest government promoted ads are about the updated booster shot, saying that if you take the updated booster, it'll prevent hospitalization, it'll prevent long COVID, when the only data that we have up until this point is for Pfizer trials in mice, and in Moderna a 50-person trial with a mysterious, unexplained 2% serious adverse event rate, which is very high, by the way, but it's a very small sample. So it's not exactly clear. There's no clear randomized controlled evidence about how effective and safe the updated booster is. We would need a larger powered trial for a longer amount of time to see how effective it is. But this is the kind of propaganda, in my view, that's being promoted by the government. And it's strange to me why media outlets would take funding to promote these things when what I would have liked to have seen during the pandemic was journalists really critically taking a look at these government agendas and seeing if these claims about safety and efficacy for these vaccines were really holding up. And I think journalists left and right completely failed to do that. And I wonder what role does that funding play? Is it possible as a journalist at a leading outlet to do a very critical expose looking at these claims of safety and efficacy, while if you flip the page, there's an ad about how amazing the safety and efficacy is? I don't know, but these are serious concerns that I think we should talk about, and that I think are they're widespread, and many people have kind of experienced this. Like my colleague Jay Bhattacharya, he's done various news shows. He's appeared on various programs, but I think he's appeared on Rising as well. But there's other TV programs that he's been on where he's told me that before the show, they make sure you're not gonna say anything bad about the vaccine, right? You're not gonna promote any anti-vax agenda. And he's not an anti-vaxxer, neither am I. But there is this kind of influence and this narrative that the media has pushed that I think has been very irresponsible when it has come to the vaccine mandates and particularly the safety and efficacy of the COVID vaccines.
Rob, I take your point about the influence of advertising on corporate media. I do think frequently there is, in fact, an effect of advertising on corporate media. You see on mainstream news shows that they frequently bring on people from the military-industrial complex without revealing that they are lobbyists for Raytheon or what have you. And so many of their hosts have political backgrounds that are not disclosed, and all of those kinds of things definitely have an impact on the news. And you see that in the tenor of their coverage as we are in the middle of this siege on Gaza. But I also am curious about this specific report and to what extent is a departure from a sort of a norm, whether or not we like it. The government spends on average about $1 billion on advertising a year. About half of that is recruitment ads, the be all you can be Army ads, I think that we're all used to seeing, in addition to promoting various public health interests and the census, for example, and reminding people to fill out their census forms and letting them know what's going on there. So what we're talking about akin to that sort of spending, which, as I understand it, has to be disclosed? This is a ad paid for by the U.S. government, U.S. Defense Department, whatever it is. Or are we saying there's something more insidious where funding for the journal itself or for the outlet itself is being tied to taking a certain view on COVID vaccine?
I wish I would know. I wish I could give you an answer to that. The report by the Blaze did include more information, and that's presumably because they didn't get that information. I'd love to find out more, and I'm going to try and do some digging into this, see what I can find and how much was actually paid, and then what's the comprehensive list of media outlets. The Blaze provided a sample of them, but there were hundreds of them. I'd be curious which ones and what the ideological spectrum of those outlets is, and I would like to know how these deals were made and if there were any strings attached. It certainly raises the question, as I was saying, when you looked at the media coverage during the pandemic, and particularly after rollout of vaccines and the vaccine mandates, there were a number of pieces that I could just go right now and search up something like vaccine myocarditis, which is a topic that I was very interested in as a young male and as a young person in particular, who was very open-minded and interested in finding what the right data was. And when I interviewed scientists like Jay Bhattacharya, cardiologists like Anish Koka and Tracy Beth Hogue, who had done fantastic, compelling studies, showing the risks of vaccine myocarditis. When I looked at what they were saying, and when I looked at what was being covered in the media, it was always, this is safe and effective. This is a small transient issue. It goes away. It's temporary. Getting COVID is more dangerous than getting myocarditis from the vaccine. This was kind of the narrative pushed by CNN, the New York Times, the Washington Post, etc. I remember one case in particular, when Joe Rogan said on his podcast in May of 2021, that when it comes to healthy 21-year-olds, I don't think they need the vaccine. And that perspective at that time was derided everywhere in mainstream media as this is being this example of extreme, crazy conspiracy theory with no basis. It's going to get young 21-year-olds killed. It's going to put them in harm's way. And that perspective at that time, and especially now, has been totally vindicated. There was no clear understanding of safety and efficacy of the vaccine for 21-year-olds with an infection fatality rate of something like 0.002%. And then that's including mostly severely ill and 21-year-olds with severe comorbidities. But for healthy people, the risk is far, far lower. And I remember reading this coverage.
Okay, yes, so we're back. It's interesting, that Robbie opened the discussion with the fact that, it is very normal for corporate entities to, to donate and to sponsor the media, right? To sponsor various programs. But he does not think that they have an insidious agenda. But whether that agenda might be something that is causing harm or not, the fact of the matter is that he who pays the piper calls the tune, right? So the fact of the matter is that there is going to be some amount of influence, an inordinate amount of influence, I should say, on what that media house say or do not say, right? The fact of the matter, I probably should say what that media house says or does not say, right? But the fact of the matter is that when we look at the COVID-19 pandemic, we saw a situation in which the government was foisting its belief system on the populace, right? And they were actually coercing us. It was a mandate. They were mandating that people take something, even though some people thought that that was not the best medical intervention for them at the time, right? So I think it's different from other, other sponsorships, economic sponsorship, corporate sponsorships that might have been, promoted and also given to these media houses. What we saw during COVID is the fact that we were forced, right? It was a mandate. But if you're talking about cigarettes or, or whatever pharmaceutical drug, then when they advertise it, I'm not saying it's right, but I'm saying that when they advertise these products, people have a choice. You can decide to smoke or not to smoke. You can decide if you're going to take Panadol or if you're not going to take Panadol. But this situation during the pandemic was different. So we can't just say that the media houses ought not to be blamed, because this is something that is the norm, that you have your corporate sponsors and your government sponsors. Now, as far as I know, right, and as far as I am concerned, the government and these private industries are merged, right? There is absolutely no difference between them. They work together. But there's an article here carried by the Jacobins, right? The Jacobin, right? Jacobin, that's the newspaper. And it speaks about, it's written by Tim Schwab, right? And there was an interview here with him. And the role of philanthropy in Bill Gates's global empire is well known, but the Gates Foundation's contributions to media organizations are huge, under-examined, and a significant part of how one of the world's wealthiest men has built and protected his image, right? And so this is an interview, and let us ask one of the questions. The first questions here asked by the journalist. We have here the period of time spanning 2020 to 2021 has been quite a roller coaster for Bill Gates's public image. He got some great press at the beginning of the pandemic. We'll come back to that in a moment, but has recently been quite a brand hit. He has recently taken quite a brand hit amid his divorce and some of the revelations that have come out of it. Can you tell us, broadly speaking, a bit more about the arc and what Gates himself has been up to over the past year or so? And how has the mainstream media narrative around him diverged from an honest reckoning with the facts and his own motivations? And Tim Schwab here is responding. It's been really an extraordinary couple years for the Gates Foundation. Early in the pandemic, the Gates Foundation inserted itself in a very central way into the pandemic response. You saw Bill Gates constantly on CNN, on the media, playing expert. He's weighing in the New England Journal of Medicine. He's publishing long op-eds. I'm going to prescribe what governments should be doing. This is a private billionaire in Seattle at the highest levels of the scientific discourse, the New England Journal of Medicine, telling governments what they should be doing. And it really showed you how institutionalized his power has become in these areas like global health and vaccines. But he's also playing an important role behind the scenes. There is a global effort, nominally under the auspices of the World Health Organization, though the World Health Organization doesn't actually have a lot of power in how this plays out. But this is an effort to get vaccines, diagnostics, and therapeutics to the global poor. And the Gates Foundation has arguably been one of the most important voices, obviously one of the most important voices, or he has been arguably the most important voice, right? Not the one of, but the most important voice and actor in that project, though a lot of that power is behind the scenes. So a lot of things we are not seeing. And not that we should make any assumptions, but the fact of the matter is that if we look carefully at the full picture, because you have to look at the broad picture, the wide picture, right? And see what the agenda really is. Many of you out there, sometimes we think that, oh yes, I saw this at my hospital. You know, the fact of the matter is that your hospital has nothing to do with the bigger agenda. And we applaud those individuals, the doctors, the pharmacists, and all healthcare, the nurses, right, who stood up and they made a difference during the pandemic. But I must say to you that these doctors, the Dr. Corys and the Mariques, right, and the Peter McCulloughs, right, they are not representative of the system and of the agenda. There is a broader agenda that you must understand. And these doctors will not be able, they have tried to, but they can't salvage the system, right? One of the reasons why I think we might not have been in a worse position at this point in time is because those doctors and nurses and pharmacists, among other healthcare professionals and citizens as well, stood up to the government and private industries and told them that we are not going to be taking a medication that we think is not best for us. But we must understand that the media is controlled. And if the media is controlled in what we call Western democracies, it means therefore that our freedoms are not going to be here much longer, right? Because the media was created, right, to be the watchdog of all democratic societies. But now we see that it's now dancing to the tune of its private corporate and sponsors, its private donors and sponsors. Now, I had written a, let me see if I have it up here. I had written a piece that, you know, about what happened during the pandemic and sent it to be published by it doesn't seem like it's coming up. Let me give me a second. Let me get it. Let me see if I can get it. Right. Right. It had been published. Doesn't seem like my. Okay. Right. Okay. Let me share my screen with you. I could share my screen here with you. so that you could have it. Okay, right. So it's up here. I had written this article and submitted it to the Jamaica Gleaner and the Jamaica Observer, but I have, many times submitted it, even last year. It was written in could be October, November of 2022. And both these media houses, the Jamaica Observer, these are Jamaican newspapers, decided not to publish it. But I know why they didn't publish it. Now, these are my words. Given Gates's charitable vaccine philanthropy, one would have thought that he would be willing to share the technology and expert knowledge so as to expedite access to vaccine in developing countries, what we call poor countries. At the outset of the pandemic, the scientific orthodoxy was that the COVID-19 vaccines would both contain the spread and thus stop the rapid transmission of the virus. This has eventually been proven to be scientific and medical misinformation. As a vigilant and perceptive observer of the events surrounding the COVID-19 narrative, I found it bizarre that Gates was so prominent on all major cable networks, given that he is not a scientist. Yet, he appeared on mainstream media as a COVID-19 expert, making COVID-19 policy decisions for world governments. As was previously mentioned, Gates is a benefactor of some of the largest and most influential media outlets. So he was indiscriminately given a platform to propel the COVID-19 agenda, as we would later discover to be the mandatory vaccination on a global scale. Interestingly, both Fauci and Gates worked laboriously behind the scenes to silence and suppress dissenting scientists and medical experts who deployed other medical remedies to treating the disease. For instance, hydroxychloroquine and ivermectin, among a cascade of efficacious drugs, were demonized as ineffective drugs in the treatment of COVID-19. Yet remdesivir, a highly toxic patented drug, was employed as the preferred standard of care in most hospitals around the globe. Scientific studies suggest that remdesivir is such a lethally toxic drug that it can cause permanent damage to one's lungs and liver. Instead, Fauci and Gates continue to promote said toxic drug as a major drug in treating COVID-19 patients. This is a classic example of political scientific tyranny. During COVID-19, democracy was under brutal attack by Big Pharma, the WHO, US CDC, FDA, big tech, government-funded agencies with the complicity of elected government officials. Now, why have the media remained silent? And where is the investigative journalism? I was asking the question, where's the incisive investigative journalism? Were Trump and his followers the major threat to democracy? Or were world governments, the public health care establishments, and their uber-rich plutocrats the greatest threat to Western democracies? And those were the questions I was asking in the article that remains unpublished. And you can see why it has remained unpublished. But I thought of sharing this with you because I thought that it would sort of help us to understand that we are living in some very interesting times, right? And we're living in a situation where now we cannot trust anyone, right? You have to read for yourselves, and you sometimes have got to trust your instinct, right? Even though it might not be provable, right? But sometimes our instinct, whatever, or the emotions, however we feel, sometimes it's best to avoid any sort of, making wrong decisions, right? So if we decide, if you see something, if you come up with a situation in which you think that this might not be the best thing for you to do, this might not be the best decision for you to take, then you sometimes need to follow that instinct, right? Because a lot of times what we think we see is not what really is. All right? Right? It is the opposite of what we're seeing. And that's why when you're telling me, oh, this person is saying and that person is saying, you also have to be aware of the agenda, the bigger picture, right? And many people have not yet understood the agenda. They're still living in the, infantile world where they think people are wonderful and they do not have any malicious intent. Well, thank you so much for joining us today. I hope that you will have a wonderful day as you continue to reflect on the, bad things that are happening in our world. I hope that you're not just reflecting on the bad things, but you're putting them into proper perspective, and it's helping you to make a more informed, to give you a more informed understanding of the world in which we live. Thank you so much for joining. See you another time. Bye.